At the Kellogg Thyroid Eye Disease Center, we see hundreds of patients each year, the most of any thyroid eye disease center in the nation. Every patient receives customized, personalized assessment and care based on their needs, circumstances, and goals. Our mission is to provide multidisciplinary, state-of-the-art care for every patient, to lead research efforts to cure thyroid eye disease, and to educate patients and the community. Our team of experts work together to focus on each patient individually. Our patient-centered approach is a model for other thyroid eye disease centers and provides the individualized care necessary to successfully treat the disease. We have also pioneered cutting-edge technologies, and based upon our research, we are leading the largest clinical trial for thyroid eye disease.
Patients with thyroid eye disease come in with a whole host of problems, and that's why we developed the center here. They come in with problems with their thyroid function. They come in with double vision, with protrusion of the eyes, with burning, pain. So there's never one solution that is perfect for everyone. Instead, it's much more important to offer a customized or personalized solution. And that can be anywhere from making sure that their thyroid is well regulated and controlled, to offering them reconstructive surgery that can restore their lives and give them back their appearance and their function, which they've lost through the course of this disease.
Before I was diagnosed, I had a very active lifestyle. I participated in triathlons, I did a lot of cycling, I swim a mile a day. Every day I can get into the pool. I did a lot of power walking and running, avid hiker. It is very disfiguring. Mine was. It first was the bulging of the eyes, and then one eye went up and one eye went down. So it made me look terrible. Emotionally, it can be devastating. You're unhappy with the way you look. There's no amount of makeup you can use to cover up how you look. And there were a lot of scary moments. But the doctors here at Kellogg were there for me all along the way. They took my phone calls, they took my emails, and they were very understanding, never denying me an appointment, and a lot of times having me come in the very same day that I sent them an email or called them.
Our physicians and clinicians understand how the disease impacts everyday life. We are aware of the emotional and physical devastation this disease brings and will help each patient fully restore their lives to the functionality, confidence, and vitality they once knew. To achieve this, we work hand in hand with our own team of dedicated experts to provide the best care possible.
The multidisciplinary approach to thyroid eye disease is unique to the University of Michigan, and I think it's quite an important aspect of how we provide care to our thyroid eye disease patients. The name thyroid eye disease is a bit misleading because it implies that really all that there is to it is thyroid stuff and eye stuff. But in reality, it's a disease that affects the entire body and really affects the entire life of the patient who suffers with it. So, and when we take care of a thyroid eye disease patient, we include an endocrinologist, a rheumatologist, an endocrine surgeon, and ancillary staff to really try to understand where the patient is coming from as an entire human being. The disease can be extremely disfiguring. It can have a lot of functional implications where people have double vision, they're unable to drive, they lose their independence, and they don't recognize themselves when they look in the mirror. And so understanding all of those different facets of the condition is crucial in order to providing appropriate care.
From a patient's perspective, the value of a multidisciplinary team is immeasurable, particularly as it relates to such a complex disease that affects patients in many different ways, from emotional to physical to psychosocial.
Many people who come for their first visit often lack hope because they feel that nothing can be done for them, or that's what they have read. We here at the University of Michigan are able to provide a multidisciplinary, cutting-edge, and minimally invasive approach to surgical rehabilitation of these patients to bring them to a pre-disease state where they feel and look much more like themselves. Our goal for evaluating new patients is for them to have an appointment within 2 weeks of their initial call, and we work very hard to arrange all the necessary appointments that they may require, for example with an endocrinologist or with a strabismus specialist who manages double vision if that is indicated for them, so that they don't have to be going from place to place to achieve that care.
Thyroid eye disease, sometimes referred to as Graves' eye disease, is a disorder of the immune system and is often associated with overactive thyroid conditions. Symptoms vary greatly and may include nervousness, rapid heartbeat, tremor, weight loss, and other features of hyperthyroidism. With such a variety of symptoms, thyroid eye disease can be a challenge to identify, but with a multi-specialty team of experts, the diagnosis is comprehensive and an effective course of treatment is established.
Thyroid disease is a hormonal disease, an endocrine disease that affects the whole body. Part of that is the effect that it has on the eye and the tissues around the eye, the orbit. The effects are disfiguring and vision threatening. In order to address the eyes, we also need to address the body. We also know that Graves' disease affects patients emotionally. And in order to take care of the patient in totality, we need to address that as well. The ups and downs of the hormones and the treatments and the reconstructive surgeries can really take a toll. Here at the University of Michigan, we are fortunate to have a group of very dedicated surgeons and physicians and scientists who work together, both to treat patients today as well as change the way that patients will be treated in the future.
Returning our patients to a pre-disease state is our passion. The ability to help as many patients as possible has been enhanced tremendously by the generosity of a grateful patient. The recently developed TED Care program was established through a generous gift with the goal to give more patients access to the excellent care Kellogg offers. The donor was inspired to help others overcome the disease by assisting with the financial burden of travel and treatment. This generous gift has inspired other longtime supporters and grateful patients to contribute toward the same goal.
We're most proud of our TED Care program that's going to allow patients from across the nation and in Michigan to receive care that otherwise they may not be able to. It provides assistance for both travel and their medical bills, and it was provided by a grateful patient to really support the type of transformation that he underwent. And we feel that this may be a flagship of our program and hopefully a direction for the country to provide this type of care.
With a dedicated team of physicians, scientists, clinical specialists, and the generosity of donors, the Kellogg Thyroid Eye Disease Center is a national and international leader in the treatment of this disease. We are leading the frontier in research, exploring cures, and pioneering minimally invasive techniques for the surgical treatment of this disease. We are a destination center for those who cannot find help elsewhere. We are their hope.